What are the biggest problems facing spinal surgeons when it comes to facet joint syndrome?
Well, facet joint syndrome or facet pain is quite a common condition which a lot of patients suffer with, and that's quite a common cause of lower back pain. We haven't got a surgical solution or an operation which gives you long-term benefit, and most surgeries at the moment for facet joint pain, like facet joint replacement or facet joint fusion, is not which is approved well by the governing bodies, and secondly we haven't got long-term results for these procedures. So we have a dilemma with facet pain because there is not one set treatment which could be minimally invasive and could give patient long-term success and with less complications.
Okay. And so I wondered, how does this device work and how does it seek to address these problems?
Because up till now, for patients who had facet joint pain, you could do a radiofrequency ablation, which is quite a standard treatment and which has been gone on for years. So once you inject a facet joint with an injection of a local anesthetic and the facet pain improves by about 75% or so, then you can go and denervate the joint. That means the nerve which is supplying the facet joint, you could ablate it or heat treat it. Essentially, you are buzzing the nerve. And that treatment could provide you some success in terms of sustained pain relief for patients with facet pain for up to a year, sometimes 2 years. And now, because with our NICE, National Institute of Clinical Excellence, has looked at the data, and they have now suggested with a new guideline which came up in March 2016, that patients who have facet joint pain and are complaining of chronic back pain, more than 5 on a visual analog score, they should then have a facet injection as a diagnostic procedure. And if the facet injection gives them more than 75% pain relief or up to 100% pain relief, then one should give them a radiofrequency denervation as a treatment of choice. And this is now which is being accepted universally as a national guideline throughout the UK.
And so how does Denervex's system work in particular?
This system is slightly different from the radiofrequency rhizolysis we do at this moment in time, because it also addresses the issue of the facet capsule. And along with denervating the nerve, that is the medial branch nerve, we are also denervating the facet capsule. And for that reason, there is this less likelihood of the nerve regrowing back and patient getting a sustained relief in their symptoms. And we're talking relief for up to 2 to 3 years. So there is an added benefit of giving patient a sustained pain relief with another minimally invasive procedure which is similar to the RF procedure we were used to from before.
Okay. I wondered where you think the future lies for this technology. Are there any exciting upcoming developments?
In terms of facet denervation, well, this is an exciting development, I would say, which obviously we haven't got long-term randomized studies, but which is hopefully going to give our patients a long-term benefit. Following that, obviously, there is a lot of research going into cell biology and into stem cell treatment, and that could be the future long-term, where we could do an injection of stem cell to the patient and their facet will start looking new as before.